Good afternoon, everyone. Welcome to this very special episode of the Hillingdon Hospital's Trust podcast. My name's Adam Tocock. I'm your Library Services Manager, and I'm joined today by a very special guest, Duncan Alston. Duncan, would you like to introduce yourself and tell people what you do here at the Trust?
Yeah, hi Adam. Thanks for the kind introduction. My name's Duncan. I'm a consultant geriatrician, and my people probably see me mostly looking after Franklin ward. I'm there every morning, and then I also do a fair bit of seeing patients who have just been admitted to hospital and A&E. So I think I know the teams around there. Probably the bit we're going to talk a bit more today is I'm also involved. I'm the trust lead for dementia and delirium. And I also, with one of my colleagues, Yen Tai, one of the neurologists, run the Parkinson's clinic at Hillingdon. So that keeps me busy.
Yeah, sounds very busy, Duncan. Goodness me, a lot of hats. But we've called you forth today specifically because every month here at the library we kind of do a search to find out what Hillingdon folk have been publishing by way of research and papers and the like. And this last month, when we had a look, we saw that you have co-authored a paper which is called, get the title up now, Improving Conversations About Parkinson's Dementia. So Duncan, do you want to tell us a little bit about this paper and how you came to be involved with this? Because it looks like there was a lot of collaborators, wasn't there? Like it was a big project.
Yeah, so I got involved as before I became a consultant. I did a fellowship with the cognitive neurology team at Queen Square, and one of the things I got quite interested in was looking at Parkinson's dementia and also dementia with Lewy bodies, which is just what we call Parkinson type dementia, where the dementia happens before the movement symptoms. And I did quite a lot of work with a lady called Ramona Weil, who's very prominent in this field, based at Queen Square. And hence my invitation to get involved in this project. So what this was is a lot of people with Parkinson's, and we think probably about half of people who have Parkinson's for a decade will develop dementia. But actually, as Parkinson's doctors and probably as the public, you think about Parkinson's, you think about the tremor, you think about the slow walking, but actually no one really thinks about the fact that actually many of these people will get cognitive problems as well. And that unfortunately goes through to the patients and also to doctors who look after these patients. The dementia side of Parkinson's is often really looked over and not necessarily talked about with patients. But interesting, when you ask patients what they think are some of the most important symptoms with their Parkinson's, lots of them say that it's the cognitive side that they really worry about. But because no one really talks about it, they don't really bring it up in clinic. And I think, and so this was a bit of work around how do we improve that, and how do we create a toolkit both for patients and for clinicians to think about Parkinson's dementia and to talk about it. So I think the probably the more exciting bit of the paper, which I wasn't involved with, is they got a whole bunch of patients with Parkinson's and their carers to talk about their experiences, and they did some sort of quite cool engagement classes with them and asked them. And interestingly, only a third of them said that anyone had ever spoken to them about cognitive problems, but nearly all of them had cognitive problems and said they would have liked someone to talk to them about them. And that's probably the headline. The bit I was involved with is I was invited to be on a sort of panel of experts looking at what guidelines should we put out there to the community of doctors and nurses who look after patients living with Parkinson's, about what we should be doing with these patients, how we should be approaching the conversations, and what sort of our recommendations for treatment are. And this led to a new kind of booklet produced by the charity Parkinson's UK, which goes through step by step for clinicians and specialist nurses what we should be looking at, when we should be starting drugs, which are the best drugs to use, and how to manage them. And I think we think this is the first time that there's been a nice set of guidelines published that are kind of accessible to everyone.
That's an amazing output for that project. That's great. So you've got that for the clinicians and the carers, but there's like information for patients as well. Is that right? There was two.
Absolutely. So we've also put together like an information booklet for patients about memory difficulties or cognitive difficulties in Parkinson's. And it just goes in a bit more detail. It's actually really nice. It talks about, what Parkinson's dementia is, when you should think about asking your doctor about it, what are the treatment options, but it also has some really nice descriptions, patient stories, where patients and their carers talk about their experience with Parkinson's dementia and what they did and what they found helpful and what their experience was like. And I think we sort of hope that that would give our patients something to kind of link to and see that it's not just them.
Yeah, that's amazing. And another thing that I really liked about all this as well, Duncan, is that your paper is open access, so it's freely available for anyone to get to, so it can reach the greatest number as well. And the 2 booklets, they're available from the charity website, is that right?
Absolutely. Or if you want one, you can come to me and I'll give you a signed copy.
Listen, that's amazing. That's a Trust podcast exclusive. We've never had one of those before, but so that's like the broader picture, Duncan. That sounds really good, and knowing now, like, clinicians will be taking that advice on board, and hopefully like regularly checking up with people, things as they're getting their checkups and the like is great. But can you tell us then, like, I know you mentioned you've been doing lots and lots of work, like, here at Hillingdon around this type of dementia and other types of dementia as well. So do you want to talk a bit about what's been happening here at the Trust?
Yeah, so I've got a really nice setup in that I'm also seconded a day a week to the memory service, which is run by CNWL over the road at the Woodland Centre. And one of the things that that they've given me some time and money to do, which is the hard thing in the NHS, right, is to set up a what we call a CSF biomarkers clinic. So we now for about the last 4 or 5 years have been able to diagnose mostly Alzheimer's disease through a lumbar puncture. And we can now give you a very accurate answer of whether or not you've got Alzheimer's disease based on a lumbar puncture, with the results come back within 4 weeks. And you might say, well, do you need a lumbar puncture? But actually, it turns out when you take patients who've been told their whole lives they've got Alzheimer's, their whole, they've diagnosed with Alzheimer's disease, when some of them eventually pass away and have kindly donated their brains to science, we've looked at them, well, not I, but clever people have looked at them and seen that the diagnosis is probably wrong in 20% of patients. And that doesn't account for the people out there who are told they have something else, but turn out they actually have Alzheimer's disease. We don't even know about that. So it turns out that we can be as clever as we think we are with just speaking to the patients and doing psychological testing, but actually we're not that good. But now we've got the lumbar puncture. But one of the problems a little bit is that traditionally our psychiatry colleagues look after and diagnose people with dementia, but they've never needed to do lumbar punctures. It's not in their training. And they certainly, and Woodlands is a really lovely unit, but it certainly isn't set up to do lumbar punctures. So one of the really nice things is I've been able to kind of collaborate between the trusts and set the service up. So we now run it in Rockwood ward once a week, and Tony, our dementia nurse, and Simi Rai, who's our physician's associate on Franklin ward, do all the hard work. And we do 2 patients in an afternoon. So that works out about 100 patients a year. And we can now give those patients a definitive diagnosis. And I believe we are one of only 6 hospitals in the whole of the UK that are offering the service. And it's pretty good. It's had a couple of really, probably the most interesting, it's always nice when someone comes to you and says, I think I've got Alzheimer's disease, to give them a definite answer. But what's probably the nicest is when the test comes back negative. And that's really interesting because we've looked at a couple of those people, and some of them have just been taking too many opioid painkillers. We've weaned them off and they've got better. I had one patient this month who turned out to have sleep apnea, and he's now on a CPAP mask and he's loads better. So actually, I think it really has affected the way in which we're treating patients. And then, if I can go on, the other really exciting thing with this is that this probably puts us a step ahead in terms of the new Alzheimer's drugs. And you might have seen on the news over the last sort of 18 months, there have been 2 big drugs which clear the protein that causes Alzheimer's, amyloid, from the brain, that have both been successful in phase 3 trials. They're called lecanemab and donanemab. And these drugs are super expensive, quite hard to deliver, may or may not be available in the NHS this year, but we're hoping maybe for some patients. But all those patients are going to need lumbar punctures to prove they've got Alzheimer's disease before giving them a expensive and potentially, dangerous drug. And so that's going to put us a whole step forward. And I really hope that will mean that we'll be one of the first hospitals in the UK to be able to offer these drugs if the NHS approves the cost of them.
Do you know when that's likely to happen, Duncan? How far away is that?
Yeah, so the MHRA, who are the people who just say whether or not the drug's safe or not, are expected to give a decision in the next couple of weeks.
Oh, wow.
And if they say, yes, it's safe, that means it's technically, we could prescribe it in the UK, but the NHS won't pay for it. And then it has to go to NICE, who decide whether it's cost effective. And their decision is expected in September. So not that long away. We expect they'll probably say it's not cost effective because it is quite expensive. And even if it is good for an individual patient, there's so many patients with Alzheimer's disease that if we straight away gave it to everyone at the current price of the drug company selling it, it would sort of bankrupt the NHS. So they'll probably say no, but then we expect that it would probably go through, there'll be a bit of politics and a bit of behind the scenes stuff, and it's probable that they'll come back and say to us that actually, this group of patients who would benefit from it mostly, we're allowed to give it to. And I'm hoping we might have that sort of end of this year, beginning of next year.
Brilliant. I'll keep my fingers crossed, and it'd be great to get an update as well. Like when you hear about it.
Absolutely.
That'd be amazing. And this is like extra exciting to hear, Duncan, because I had no idea that any of this was happening. Excuse me. It's but it's just such a great example of the kind of cross trust collaboration that we're wanting to do more of in Northwest London as well. Great to hear a shout out to, was it Tony and Simmer as well, who were doing
Tony and Simmer,
you've been shouted out there, the pair of you. Well done. All right.
I'm deeply grateful for their hard work in LP Clinic.
So Duncan, like just one last thing before I let you get away then. So you've been part of this big project, and obviously helped co-author this paper. Like, have you got any advice for colleagues that are looking to do the same, like to get involved with things like this, to author stuff? How do you do it, and what would you advise?
Yeah, so two things. I think something that's been really, really great for my career was taking a year out before I became a consultant and going and working with some people who are really big names in the field. And because suddenly you become part of the research and you can become part of what's going on. And, some people say, well, I don't want to do it because I don't necessarily want to go and dedicate 3 years to doing a PhD, or which is, some of my colleagues would say, well, that's a great thing to do. I agree. It feels like a long time. I only did 1 year. And I think you can do that. And people say, well, how do you organize that? But actually, all I did was send some emails. And I think generally, people who are big names in the field are often have money for projects. They're often looking for good candidates. So actually, I found getting a place to go and do a fellowship at Queen Square was actually relatively straightforward. And I think I'd just encourage people, if there's something you really want to do, put your name out there, email some big names in the field, ask them if you can come work with them, because I think the answers are often yes. And I say the only other thing is make the most of going to conferences. I think around COVID, we've had a lot of conferences that kind of gone online, and it's very tempting to do them online because you can sit in your desk, you don't have to travel anywhere, and you probably get a lot out of the content, but you don't meet people. And I've been finding going to them in person and meeting people opened so many doors where you could talk about projects and collaboration. And I personally think that's almost worth more than what you gain from the conference.
Yeah, the networking aspects.
Yeah.
But that's some great advice there. Thank you, Duncan. I should say as well, to add on to that, if you are interested in finding out what conferences are on there and the like, we can always help you with that in the library, everyone. So get in touch if you want us to put the feelers out and see what's out there, and we can advise on that. Well, on that helpful note, I'll say, Duncan, thank you very much again. Great to have you with us, and good luck with it. And that's it for another episode of the Hillingdon Hospitals Trust podcast. Duncan, cheers. It's goodbye from both of us. See you next time.
Goodbye.